I'm Huda.
Hi, I'm Sofia.
Hi, I'm Jaing.
Hi, I'm Li Ziyun.
Hello, I'm Fahmi, and we are from Group 12 will present the hip implants. These are our group member names and their metric numbers. So, what is hip implants and its applications? Hip implants are medical devices that function to restore mobility and relieve the pain that usually associated with arthritis and other hip diseases or injuries. Normally, every hip implant system has unique design features such as size, shape, material, and dimensions. There are several factors that may influence the outcome and longevity of a hip implant, including a device design feature, surgeon experience, implantation technique, and individual patient characteristics such as age, sex, activity level, and overall health. Generally, there are four types of total hip replacement devices available with different bearing surfaces. So these are the overview of general materials used in hip implant. First is MOM, metal on metal. The ball and socket are made of metal. Second is MOP, metal on polyethylene. The ball is made of metal and socket is made of plastic, which is polyethylene or has a plastic lining. Next, ceramic on polyethylene or COP. The ball is made from metal and socket is plastic. And the last one is COM, ceramic on metal. The ball is from ceramic and the lining or the socket is from the metal. Next, move on to the components. What makes up a hip replacement implant? As we know, a natural hip joint is composed of two main components, which are the ball and the socket. During a total hip replacement, or we call that as arthroplasty, four parts are introduced to create a new hip, which are first, the acetabular component, or we call that as socket. So the ball-shaped piece represents the new socket. So this ball or cup is fit into the resurfaced socket, and usually it is made of metal but occasionally made of ceramic or a combination of plastic and metal. Second is the acetabular liner. The plastic liner fits into the acetabular component, which give femoral head or the ball to glide easier and more naturally in the socket. So normally, this piece is made of high quality plastic. Next one is the ball or the femoral head. So this thing will fit directly into the new plastic lined socket and is attached to the femoral stem. So there are many shapes and sizes of heads. So these are made of durable metal, plastic, ceramic, or sometimes combination materials. And the last one is the femoral stem. So the stem attached to the ball and supports the new hip joint. Usually this metal piece is porous because it could allow for the natural bone to grow and attach to this piece, which replace the femur.
Hi, I'm Jing and I'm going to present on general properties of biomaterials used for hip implant. Alright, so biomaterials used for hip implant should exhibit the general properties, where the first property is high biocompatibility of the material. Biocompatible material is material that do not produce toxic and non-carcinogenic when exposed to body or bodily fluid and chemically stable as well as corrosion resistant. The material should have the ability to perform within an appropriate host response in a specific application without causing a harmful tissue reaction such as pain, swelling, or necrosis that could compromise the function. Next, high wear resistance should be one of the criteria for biomaterials properties. Its wear-resistant parts are used to combat the damage to machinery caused by high temperatures and corrosion. The third property is choosing a bioactive materials. Bioactive materials is material that have feature adaptiveness to the biological environment. The surface of femoral stem should be bioactive in terms of the osseointegration, where it is a direct structural and functional connection between the bone and the surface of an implant. Thus, the femoral stem of the hip implant should be capable of bonding to bone. It is critical for the stability of implant and osteolysis can be prevented. Apart from that, the chosen biomaterial should perform adequate mechanical properties, which in terms of young modulus, yield strength, tensile strength, abrasive wear, ductility, hardness, toughness, and fatigue strength. Furthermore, biomaterial should have the high maximum allowable stress. This means that large number of stress cycles in a material where the material will not fracture easily under greater amount of force or load applied. Lastly, Non-magnetic materials should be our choice as non-magnetic substances cannot be magnetized. Alright, proceed to next, conceptual design sketch. The diagram shown is the conceptual design sketch of our proposed design of hip implant which I had drawn. Design of ceramic on ceramic COC for our hip implant is applied in which we use ceramics, specifically zirconia toughened alumina for liner and femoral head. Polyethylene, specifically highly cross-linked, which also known as XLPE for acetabular shell. While for the femoral stem, we use metal or to be specific, the titanium alloy. So, why we choose ceramic on ceramic as our material used in the hip implants? Generally, ceramics are used to build engineering components when wear resistance, hardness, strength, and heat resistance are needed. First, ceramic basically has greater hardness than metal, which means the greater of ceramic material's ability to retain its shape in the presence of external forces. In other words, there is presence of greater compression strength in ceramic, resulting in greater capability of material or structure to withstand the loads tending to reduce in size. Ceramic on ceramic implants also have a life expectancy longer than implants with other combination due to their lesser coefficient of friction, which result in low wear rate. Based on study, patients that had a ceramic device implanted had lower rates of revision surgery, dislocation of device, and bone deterioration. Next, it is biologically inert, in which it does not initiate a response or interaction when introduced to biological tissue. Also, ceramic on ceramic has better lubrication properties in terms of the thermal stability, high resistance to oxidation, high viscosity index, corrosion prevention, and hydraulic stability. It can be polished to a much lower surface roughness. Lastly, COC total hip implant exhibit the excellent wettability. Excellent wettability is important in bonding or adherence of two materials, as well as to ensure the synovial fluid is uniformly distributed between the implant surfaces. To conclude, clinical results have confirmed a higher survivorship, lesser wear, and lower osteolysis, making these bearings an excellent choice for young and active individuals. Research also shows that ceramic on ceramic bearings decrease wear, bone, and muscle loss, and lower the risk of dislocation. The human body also tolerates the ceramic well with low reactivity and no toxicity.
Hi everyone, I'm Jain and I'm going to talk about the material selection, degradation of materials in body as well as the fabrication of the device. So first, the material selection. For the acetabular shell, we choose the highly cross-linked polyethylene, which is also called SLPE, as it found to be extremely resistant to abrasion and other wear and tear compared to conventional polyethylene. Besides, the biologic activity of the wear debris and the osteolysis of SLPE are actually very much lower than using conventional polyethylene. SLPE is produced from polyethylene under high pressure with organic peroxide, which create a free radical. SLPE is commonly produced based on three processes, which are cross-linking, heat treatment, and sterilization while avoiding exposure to air. Cross-linking is accomplished by using either gamma radiation or electron beam radiation to break the molecular bonds and increase the wear resistance. While heat treatment is then carried out to eliminate the free radicals, while sterilization process is to ensure the long-term stability of the implant against oxidation. So for the liner and femoral head, zirconia toughened alumina, ZTA is chosen. ZTA is a kind of composite ceramic material with zirconia grains in the alumina matrix that combines the best characteristics of both alumina and zirconia, which are the great wear resistance, chemical and hydrothermal stability of the zirconia, as well as the strength and toughness of alumina. Since base alumina matrix assures high hardness, by adding a fraction of zirconia to alumina results in the composite material with improved toughness and resistance to fracture propagation, as well as the commencement of cracking. Furthermore, ZTA lowers the kinetic hydrothermal aging, which also could be a benefit over other materials. Moving on to the last material, the titanium alloys are chosen to be the femoral stem of hip implant due to its high compatibility, as it has outstanding resistance to corrosion by body fluid. Despite the fact that the titanium is highly reactive to oxygen, the construction of passive oxygen layer and the soaked interstitial solution provide exceptional corrosion resistance in the human body. Another benefit of employing titanium alloys is that the load-bearing devices' fatigue properties are not harmed by contact with body fluids containing strong chlorine ions. Titanium alloys are also employed because of their ability to join with bone in the osseointegration process, which is a direct bone attachment to the implant into the bone with no fibrous capsule contact, allowing loading forces to be sent directly to the bone. However, titanium alloys are not used in fabricating femoral heads due to their poor wear resistance. I will then explain about the degradation of materials in the body. Before I talk about it, I would like to mention that the degradation of materials could not be avoided due to many factors such as body environment or the failure of the surgery. So as a permanent implant, heat implants is actually typically degrade very slow, but it does progress over the years. So first we talk about the degradation of the SLPE, which make the acetabular sharp. Since SLPE is a polymer usually undergo chemical degradation due to contact with body fluids and tissue. For example, hydrolysis may occur due to the reaction with water in tissues, oxidative degradation due to oxidants produced by tissues, as well as enzymatic degradation in vivo. Besides, physical degradation may also happen due to mechanical loading and wearing. For the ZTA, which make the liner and the femoral stem, friction and fatigue induces and shock-related degradation may exist. According to the studies, the ZTA component is subjected to wear, shocks, and mechanical loading. The elastic imbalance between ceramic materials and bone can cause ZTA sockets to loosen. This results in the degradation of femoral stem as well. Besides, shock-related degradation due to shocks increase wear that triggers low temperature degradation, which increases wear as well. The degradation of ZTA component of the femoral head accelerate the degradation of titanium alloy, which make the femoral stem. The titanium alloy, which covered with thick titanium oxide layer, is to prevent corrosion. However, when time's going on, the oxide layer may be mechanically removed or loosened due to metallic debris, which caused by extreme position achieved during gate routine. The wear particles caused by degradation may lead to inflammatory or toxic response, even though the bulk materials are biocompatible. And the last part I'm going to present is the fabrication of heat implant. The process selection of fabrication of a total heat implant is very reliable on the materials to use. Like for SLPE, molding and machining are very essential, while for ZTA, sintering and then grinding and polishing will be carried out then. And lastly, for titanium alloy, it is usually shaped by forging or investment casting, then rough machining, polishing, and coating. The shape accuracy, surface roughness, and surface integrity of the heat implant are commonly achieved by polishing. So that's all from me. Thank you.
Process and characterization tools.
Instrument machine is a displacement control frame to measure mechanical properties of the material. Motor encoder and load cell are functioned to collect data during tension, compression, and 3-point bend test. How does instrument machine work? The load cell is installed on the load frame stock, where material specimen is held in the place inside the instrument tower by fixtures and grids. The central course head will travel vertically after testing procedure has been launched, propelled by huge lead screws placed inside the columns. It is advisable to not touch the machine while it's moving. The speed, distance, and direction of travel are determined through testing protocol. Instrument machines are able to perform 3 different tests, such as tension test, compression test, and 3-point bend test. Tension test. Jaws of upper and lower wedge grips hold material specimen. The upper grip attached with load cells, while the lower grip attached with the fixed base plate of crosshead. The upper grip and load cell remain stationary, while the crosshead will travel downward. To increase accurate strain measurement, clip a tensiometer gauge to the material specimen cross-section. Compression test. Vice grip fixture attached to the base of plate of crosshead will hold the material specimen. The platen that is attached to the load cell apply compressive load to the specimen. The crosshead will move upward while the platen and load cell remain stationary. 3-point bend test. The support cylinder fixture is attached to the base plate of the crosshead and hold the material specimen. The loading envelope that is attached to the load cell and apply compressive load to the center of the specimen. The crosshead will travel upward, while the loading envelope and the load cell remain stationary. Thermogravimetric analysis measures weight changes over time in the material as the temperature changes under a controlled atmosphere. This machine is able to study the physical phenomena such as phase transitions, absorptions, and desorptions. while the chemical phenomena includes thermal decomposition and solid gas reactions, such as oxidation and reduction. The temperature of the sample in the frame is gradually increased as the mass of the sample is measured on analytical balance outside of the furnace. This figure shows thermogravimetric analysis curve. The weight of the sample is plotted against temperature or time to illustrate thermal transitions in the material. The mass loss is observed if a thermal event involves loss of the photon component. How does thermogravimetry work? This machine comprises of high-precision balance and sample pen. The pen will hold the sample material and is heated or cooled during the experiment in the furnace or oven. The thermocouple function to accurately control and measure the temperature within the oven. The mass of the sample is constantly checked. The inert or reactive gas can be added to purify and manage the environment. The analysis is carried out by gradually increase the temperature and graphing the weight of the substance versus the temperature. The instrument is controlled by computer, which also processes the output curve.
Next, I will be presenting about scanning electron microscopy, or also known as SEM. SEM produces detailed, magnified images of an object by scanning its surface to create a high-resolution image using a focus beam of electrons. Different modes of SEM also exist for characterization of biomaterials. This is the example of SEM. The components in SEM that we need: first of all, we need electron gun that consists of cathode and anode, deflection coil to deflect the electron beam, condenser lens to control the amount of electrons that travel down the column, objective lens to focus the beam into a spot on the sample, SED to attract the secondary electrons, and also additional sensors to detect backscattered electrons and X-rays. So how does SEM work? First of all, the electron source will generate electrons at the top of the column. The electrons will be accelerated and attracted by anode that is positively charged. The electrons will pass through a combination of lenses and apertures to produce a focus beam of electrons. Scan coils control the position of the electron beam. The objective lens is the last lens in the sequence of lenses that create the electron beam. As the lens closes to the sample, it focuses the beam to a very small spot on the sample. When a current passes through these coils, they generate a magnetic field. Electrons are highly sensitive to these magnetic fields, which therefore enables the lenses in the microscope to control them. Next, we choose X-ray diffraction (XRD) as one of our characterization methods. XRD is a technique used in material science to determine crystallographic structure of a material. XRD works by irradiating a material with incident X-rays and then measuring the intensities and scattering angles of the X-rays that leave the material. Basic elements in XRD is X-ray tube to generate X-ray, sample, which is a place where X-ray is directed onto, X-ray detectors to detect, to collect and process X-ray. Chemical characterization of XRD. As I've mentioned before, XRD is used to study crystalline structure of materials. The atoms in crystals are a pretty array of coherent scatterers, thus can diffract light. It uses information about the position, intensity, width, and shape of diffraction fixed in a pattern from a polycrystalline sample. To identify the phase, chemical composition, and crystal structure of each material in our design, we can use XRD. So how does XRD work? First of all, the X-rays collimated and directed onto sample. Intensity of reflected X-rays is recorded when sample and detector rotate. When incident X-rays impinging the sample satisfies the Bragg equation, constructive interference will occur. Detector will detect, process, and counter the diffracted X-rays. Sample rotates in the path of the collimated X-ray beam at angle theta. Detector is mounted on an arm to collect the diffracted X-ray and rotates at an angle of 2 theta. That's all from me. Thank you.